Okay, good evening, everyone. Are you able to hear me? Okay, welcome to the live talk from School of Business and Technology, IMU University. This live talk is about advancing your career with postgrad study in health informatics and analytics. This is a program under our center called Digital Health and Health Informatics Center under this School of Business and Technology. So now here we have Prof. Saravanan, who is our dean, who will share with you after a brief session of my talk about the industry landscape, about digital health technology, and how you can contribute to it as well. And then we have Dr. Kairu as well. He is one of our current student, although he will be slightly late due to some engagement. He is an physician, emergency physician in Hospital Kuala Lumpur. So he's currently studying part-time as our student in Master in Health Informatics and Analytics, and also at the same time he has a full-time job at Hospital Kuala Lumpur. He's very participative, very active person in digital domain. Okay, and me myself, I am Dr. Chua. I'm the program director for this postgraduate studies program in IMU University. So let's get started. Okay, some housekeeping rule before we look at the main content. We have muted the microphone for all attendees. So if you have questions, we welcome your questions, and please put in the questions in the Q&A panel. And the live talk will be recorded. So it has been recording already. The recording has already started. So yeah, just for your attention. Okay, then the big question is why MHIA? MHIA is Master in Health Informatics and Analytics, the abbreviation for it. So we look at it and we might be wondering how does it benefit me? And now some of the factors that explain why include all of those that are listed here: high job growth, career advancement, flexible study options, career opportunities, and international recognition. One of the things that we would like to highlight is that our study option, we have full-time, we have part-time, and we provide the flexibilities for our students to attend hybrid at times that they cannot make it to the class. So we actually empower the students instead of let students being restricted by very rigid physical classes. So this is one of our selling point. And then of course the others include high job growth because digital health and health informatics is one of the fastest growing economy sector globally. The leaders include Korea, include Thailand, include China as well, right? Job opportunities increasing twice as fast as other sectors. And then career advancement. These are not just for physicians, not just for doctors. The career advancement can be for people who are working around the medical industry, including for dentists, including for nutritionists, even including for uh, professionals who are working in the IT domain. And we have students coming from various backgrounds and even in HR, even in HR as well. So our students come from various background and they are able to advance their career in this direction. Then you have career opportunities. If you take the program, you will open doors to health data informatics and analytics roles in private and public sectors, such as ministries and further studies at the PhD level as well. And then there's international recognition. We have partners with University of Strathclyde and another partner in USA, Rutgers University. So let's go into the curriculum itself. If you are a very, very busy professional, you might be able to take a smaller version of the postgrad program, which is either diploma, postgrad diploma in health informatics and analytics, or postgrad certificate in health informatics and analytics. But if you are highly committed, you are able to take the master program. So actually they add up one layer after the other. So semester one, if you just take the postgrad certificate, you will take modules such as health systems and informatics, health data collection and preparation, health data analytics, health data management, and two foundational electives. These two foundational electives are taken by most, if not all, our students, because they actually empower students to build the foundations in mathematics and programming. So many of our students coming from medical background, they will be in doubt whether they are able to cope with programming, they're able to cope with the mathematics requirement in this domain. So with this, we actually build your foundation. We have the modules to build your foundation from the very beginning of the postgrad program. And then if you're taking the postgrad diploma as well, the same modules will be taken in semester one, which is from September each year to February. So roughly to February, but usually it ends slightly earlier, right? Before Chinese New Year. And you also have semester two for postgrad diploma in semester two. You will be taking two modules. One is seminar in transformative technology in healthcare, and another is health data visualization. And if you are taking master, you look at the semester two, you will be taking a healthcare analytics research project, which is tackling immediate, very meaningful healthcare analytics problems, which will increase the throughput of the healthcare system, right? So it will help the doctors to look at cases faster, more accurately, and provide efficiency to the data and data analytics system. It can include things like AI incorporating deep learning models into the system, and even simple digitalization projects can also be included, because not every organization is already completely digitalized, right? So yeah, we have a master program which is 40 credit hours, and it's spanned for 1 year. Usually the intake is in September. Of course, everyone who is interested can register anytime, can apply anytime and register anytime in the year. But the starting will be in September and the finishing will be in August in the next year. So you will spend 1 year to finish the program. Okay, then let's talk about job opportunities. Okay, in the healthcare areas, right, you will be able to look into occupations such as health system and service designers. You'll be able to help with digital health transformation. So you'll be digital health transformation manager, and you can do some data analytics and forensic. Actually, our undergrad is involved in a project that's related to forensic science, and we use digital facilities to recreate the forensic scene, which is done by our undergrad in the department. And the work scope include implement processes and system to support medical record documentation, drug tracking and tracing, insurance fraud detection. Okay, for insurance fraud detection is a big thing. And fraud doesn't only come from people who claim, right? It might be some mistake by the healthcare provider side, or some overlook, right? So I think Prof. Saramanan will share with you much more in this, because he is actively working in this area. And next area is about information and communication technologies. Next area of career opportunities, you will be able to be data engineer, business intelligence analyst, particularly in the healthcare domain, such as medical devices, medical related software, data model engineer as well. So you'll be able to gather business data through many different ways, such as with data mining, then transform the data into insights that drive business value. So data mining is not actually getting the data. It is mining of the meanings in the data, mining of the meanings in the data and actionable predictions from the data. And next, we look at career opportunities in data science as well. Data science, if you are interested in data science careers, you'll be able to be a data analyst, data scientist, and healthcare data scientist, business analyst as well, in companies that are working on health related area. So you'll be responsible for finding trends in data sets. It can be operational data set, it can be health related data sets, right? And developing algorithms to translate raw data to useful information, decisions, policies, right? Those raw data, they will give us a very good idea of what decisions to make, what policies to shape, and then how do we achieve some targets, for example, in near term, 1 or 2 year, or in even long term in 5 to 10 years. Okay, and then for front lines, you'll be able to quantify the statistics, report, fix problems, reconciling data across healthcare system, making them highly valuable. Highly valuable means people are able to trust the data, use the prediction, and reliably achieve the targets. And for the other opportunities, you can also look at being a researcher, meaning after your master program, you'll be able to pursue research such as being a PhD student, or being graduate research assistant, yeah. And also in entrepreneurship, you might be able to establish your own company. But establishing your own company is, of course, not a simple task. It's not for everyone. It requires a lot of resilience and a certain personality who are very tireless and very purposeful. Okay, so what are some real examples? These are actual positions that I am listing from our alumni. So students who come in studying our program. After studying, what do they do? So they become business intelligence officer, data analyst, digital protege, data quality officer, senior healthcare data specialist. So these are actual job title that our alumni are holding. So these are just a few that we have recorded, because we are in constant contact with them. So some of the projects that our students have already done, of course, these are historical. We have a current batch of students just proposed their project, but we still haven't put it into the slide yet. You can see that they span through pharmaceutical, medicine, psychological, dental, nutrition and dietetics, public health, and medical data as well. So if you look at the medical data itself, the student has done a project to apply transfer learning in auto codification of ICD-10 code for medical diagnosis in Malaysia. This is a very useful application of health data analysis skills. And then public health, you can see that the students apply the skills into aging, into social determinants of health, and then also talking about the key factors influencing work experience among doctors. So these are public health. And then if you look at the medicine area, the projects can be very forefront. For example, number 7, the student looked at application of large language model, evaluating its efficacy, right? And then we have image processing project as well, which is under me, right? The students work together with me for this project number 8 about tuberculosis diagnosis and chest radiograph, which the student use a lot of data from multiple institutions to develop the machine learning model, and the developed machine learning model will be able to use in the ministry that he's working in. So these are just some of the example. We can talk more about that if you would like to ask some questions. And then we have industry partners. Right? These industry partners, they work with us either as our partners who provide jobs to our undergrad, or they can also through conversation or negotiation to do project together, right? But it is on case by case basis, and these are some of our partners. Okay. So that's all from me, and if you have question, I would like to invite you to write in the Q&A chat box, right? In the Q&A chat box, and we will check it and answer it at the end of the talk. And you are able to reach me if you are interested in discussing or interested in joining the program, right? So you'll be able to reach me by this WhatsApp and scanning this WeChat as well. And my email address is here as well. So thank you all for listening. Let's pass the time to Prof. Saravanan.
Thank you so much, Dr. Chua. Indeed, it's a privilege for me to join this webinar, and I have a very hardworking PD for this program, and none other than Dr. Chua himself. He works very hard. He's actually the lifeline, and he helps me with the program. So PD basically means program director, and Dr. Chua helps me to curate, improve the content, and make what we teach here at IMU very, very relevant for everyone. I mean, everyone means all our students, right? So I come to understand that, you know, a lot of listeners, those I mean, who are listening in today, may have some questions, like, is this program right for me? Earlier I heard Dr. Chua saying something about mathematics. Will it be very heavy in quantitative methods or statistics? So don't worry about all that because what we believe in IMU is we want to be the scaffold to help you in your learning journey, right? So this program is meant for clinicians, is meant for IT professionals, meant for healthcare administrators, even fresh graduates who want to, get involved in the growth of digital health. Because healthcare is no longer just about doctors and hospitals. Healthcare is about data, healthcare is about decisions, healthcare is about digital transformation today. Just look at the amount of, scanning and image processing that takes place at the hospital. You're talking about MRI, CTs, PET scan, X-rays. The list goes on, and a huge number of samples are collected from blood to urine samples, for analysis, and there's a lot of data actually. So going back to what I just said, it's not really healthcare is not really just about hospitals or doctors, but it's understanding data, using data to make more informed decisions and leading digital transformation. So the question is no longer should we help, should we adopt, should we understand digital health? No. The question now is who will lead this? And I think I'm talking to the right audience. Those who are listening in, you are the ones who are going to lead this. 20 years from now, 30 years from now, there's going to be a huge transformation on health. Looking at digital health, there's going to be a huge transformation. We all are not, going to be the ones who are leading it, but it's going to be you, the next generation, right? So I'd like to kind of put that out first to the audience today. This is a program that will help you to be relevant in healthcare next maybe 5 to 10 years, because health informatics, analytics is no longer an option. I feel that it's a necessity. It's very essential. And I'll give you all some examples, right? Let's look at the traditional framework. We talk about paper-based records. Even now, there are some clinics that are very much paper-based. We are moving from paper-based records to EMR, to EHR. So that's a digital form of healthcare there. In the past, we talk about reactive care. Today, we're talking about predictive care. In back in the day, it's more experience-driven healthcare. Today, it's more data-driven healthcare. In the past, systems were silo systems. Today, we are talking about interoperable ecosystems. So the shift is already happening at a very interesting pace. And to support this, you have, the government, the National Malaysian Health White Paper, we have My Digital, and all different, parts of growth in ICT. It's kind of fueling this growth in digital healthcare. So we would like to see, our audience today, we would like to see you to be the future healthcare leader, not just a clinician or a manager, but an individual who can be the translator between data, technology, and patient care. In fact, I had a student, right? She's from Sarawak. She's a clinician, and having taken some of these modules, um, like I always say, from zero to hero. So the progression, I mean, 7, 8 weeks of intensive, data analytics, coding in Python and all that. When she was exposed to all that, she became very, very interested and said, I think this is where I'm going to go. And she can kind of see a pivot in her career. Being a very good clinician herself, now she has got this additional, skill that she never would have had if she had not taken that module. So I think everyone in the audience today, I think this is what is in store for you. And I just probably like to, close by saying that it's an opportunity for you to reposition your career trajectory. If you already have a career as a clinician, this will kind of reposition, it'll kind of give you additional skills, and it will take your career further. And if you have a question on why IMU, well, IMU is already at its core, IMU already has a healthcare DNA. I mean, we all know IMU, the healthcare focused university, right? And within IMU, you have a real world healthcare ecosystem. Dr. Chua talked about industry, how we integrate very nicely with industry. A lot of projects that Dr. Chua was presenting just now, that our students are working on, they are real projects, solving real healthcare problems. And that is because of the integration with industry that we already have. And Having a technology and a healthcare and a little bit of a business combined, I think you will get a triple advantage, not just knowing IT, not just knowing healthcare, but it's kind of an integrated model that you will understand. A lot of hospitals today are run by non medical personnel. But what if we can just empower you to be that CEO? Because it's nice to have CEO sitting and running a hospital, a medical doctor becoming a CEO running a hospital, then a non-healthcare person from a non-healthcare background to run a hospital. That's another way to also look at it. And we've got plenty of other, bonus items in our offering. We are also Huawei ICT Academy. Those who become our students, those of you who become our students are also able to access Huawei modules and get certification from Huawei as well for free. And I think Dr. Chua presented on the internationalization on Rutgers and other institutions that you can go to, and who we are working with. So we are very committed to producing world-class digital health leaders, and we will be very, very happy to answer any of your questions, and looking forward to see you. Let's work on this together. Let's build the future of digital healthcare together. Thank you. Over to you, Dr. Chua.
Thank you, Prof. Saravanan, and for the very enlightening talk. Let's invite Dr. Khairul, who is our current student, part-time student, to share with you some of his insight about the program and his growth through being in the program. Khairul, yeah.
Yeah. Assalamualaikum. Everyone can hear me? The Chua can hear me?
Yes, can hear you loud and clear.
Yeah. Sorry for the delay of joining the webinar earlier on. For introduction, I am Dr. Khairul Izwan bin Hashim. Currently, I am working at emergency department, HKL, one of the busiest emergency department in the country. So, but joining MHIA has been a good new journey for me, even though currently I'm busy in MC department. But initially, honestly, I wanted to join this program because I'm into IT and I'm into data management and so on. But as I go on, actually, it's more than that. MHIA has taught me about designing the data itself, about the flow of managing patients. So it's not just uh, uh, patients care. It's not just IT per se. It's not just coding, but it's about a next level of managing patients, which is the flow of patients, managing the real problems, which is above the patient's care itself lah. about the journey of this program, I'm already at the third trimester, final semester. I'm taking part time at the moment. I'm taking part time, so this is my second year, so my fourth semester. So the class is it's not that heavy, but there's a lot of things to do in terms of the uh, assignment. But it's not that difficult. Yeah, it's doable with support from the lecturer itself. The class is on weekends. Yeah, you have to sacrifice your weekends a bit, but you can manage. If I'm taking part time, I can manage. There's a time when I cannot take a lot of subjects, then I consult the supervisor, consult Dr. Chua as a course coordinator. What is the best time for me to take the course itself? So apart from that, there's a lot of activities going on. Uh, in the first semester itself, I've been joining the hackathon on the first semester. So at that time, I just learned about coding. I just learned about Python. It's new to me, but I got the chance to involve in hackathon, was organized by IMU during the health week. Yeah, meet new features, meet new friends. I get to explore that kind of experience. Apart from that, I also join other digital day in the IMU day, I think, along with the lecturers. We get to get involved a lot of things lah. Apart from that, I'm also currently is ongoing doing my project. So my project is about AI. I'm incorporating AI with detecting misfracture in MC department. So this project we have to it's related to our clinical features. So for those who are from clinical background like me, so I'm a practicing doctor currently, emergency physicians. So I'm also want to integrate what I'm practicing now and what I can benefit from MHIA itself. So I proposed to Dr. Chua that I want to make sure that this project is beneficial to my department, beneficial to my patients, so we can integrate what we learn during this master's program and to benefit. So what I think after finishing this 3 semesters, I think there's a lot of things that we can do, especially in government settings. I'm from government. There's a lot of things we can do in terms of improving our systems. So patient care is number one, yes, but above patient care is the managing the overcrowding, managing the patient's flow, managing the data. There's a lot in our departments. That is another part that nobody does it. Yeah. So it's our time that to learn about this. It's not too late. After being doctor, we can still learn, and this is a platform that we can learn structured way and get the right pathway lah, in terms of having to learn a bit of IT, a bit of designing the medical pathway, designing the flow of patients' data, and so on lah. So I think that's all from me. I'm happy to receive any questions from the floor, and I hope I can share a lot of things more with you guys. Back to Dr. Chua.
Okay, thanks, Kairu, for your sharing. Very insightful sharing about being an active student, an active part-time student. Actually, our part-time cohort number is growing, already overtaken the full-time number, right? Because our students come from working adult, working doctors. So it is very beneficial for them to upgrade through this channel. Okay, let's answer the question. The first question, I think our Prof. Saravanan already answered. And then we have 2 more questions. One question is, what role do we envision AI playing within this program's framework? Okay, I can answer this question. AI, if you are talking about LLM, right, it will be a studying companion, right? But it is not just that, all right? As someone who learn about analytics, and learn about programming skills, we are able to ask AI to work, not just asking it question. We are able to deploy it. AI include not just large language model. Large language model is just one type of AI. We have AI that can analyze Excel sheet, all right? Very simple AI, for example, support vector machine, for example, decision tree. Then we also have AI that can recognize image, for example, a VIT model, right? A deep learning model. And then we have LLM. So all this, you will be able to use it like a tool in your hand to ask it to do things for you, to ask it to predict the outcome such that you can shape your actions. You can make decisions based on its predicted outcome, and then you're able to evaluate how well it performed, and you're able to improve its performance as well. And by being so-called computing literate, not just being able to use computer, but being able to program and being able to do very involved analytics, you will be able to orchestrate such kind of tools, not just one or two, but you are able to schedule them, orchestrate them, even make them agentic. Agentic means it's a very, very forefront work. It become very hot topic after large language model is available widely. But agentic means the computing tool can help you to do take action. For example, sending an email. For example, scheduling. For example, creating of file, moving of file. All this, if you are able to use it, if you have some knowledge and skills to use it, then you are very, very well equipped to bring the whole digitalization era forward, right? Not just in health, of course, include health, right? But in more than just health, including for the patients, for operationally, for doctor and for hospital. Okay, next question. I think Prof. Saravanan is helping to answer a lot of the questions. Would like to ask Dr. Khairul two questions. As a practicing clinician in a busy government hospital setting, what made him decide to pursue this program part-time rather than applying for Hadiah Latihan Persekutuan for part-time study? Okay, we have students who are holding every batch, at least one student holding Hadiah Latihan Persekutuan full-time. Yeah, so this is a very relevant question. Khairul?
Okay, yeah, I can answer this question. Okay, basically, for HLP lah, HLP is for those who never had before. Or if I want to take HLP, I have to take a higher level. So I am already a pakar in emergency medicine. So I already used my HLP during my master's program previously for emergency medicine. So I cannot take any more HLP for this time around unless I want to take PhD under IMU, which is I plan to later on lah. If I grad from this master program, I would like to try to apply for HLP for PhD in informatics. I believe it's in Scotland. That's all right. Yeah, I think so. If I can manage to get it into lah. But that's for the answer for the HLP. So for those who is still not taking any master's program, you can apply for HLP. And if in HLP, few of my batchmate before this take HLP, you have to take it full time. So full time means every weekend is your health informatics weekend lah, mean your class. So you have to struggle. There's some class overlapping each other, but it's doable. Yeah, there's sometimes they are stressed, but yeah, they still can chill and happy also and still can pass through. Yeah, so if HLP, yes, you can take it if you are in degrees. I mean, you just haven't taken any HLP program as masters before. So I already taken, so I cannot. So I'm using my own fund. You can take from your EPF, withdraw some, and you can pay by semester. So it's doable and you can pick slowly. Yeah, I think another
About
question, right?
the PhD program, right, in health informatics, right? Our department currently does not have our standalone PhD program, but you can do a PhD program in health informatics topic with us. But the program will be under another sister department's program. Yeah.
Mm-hmm.
So it's not under our program. So we are just using the program, registering under the program, but the people who are supervising you and the project title will be relevant to the health informatics area.
Yeah.
Yeah.
For the second question, I think should I answer that or
Okay, I will answer. How much
yeah?
of a computing proficiency do you have to have before starting the program? This is a frequently asked question because
Mm-hmm.
most of our students are doctors. So doctors, they are worried that they don't have enough programming background, or they don't have enough mathematics or statistics background to feel comfortable starting the work, starting even the coursework, not even the project work. But I would like to assure our audience that the course has got foundation building modules for our students to get into the field of statistics, the field of mathematics and programming. Of course, we provide you the foundation building blocks, and then we work together to build up your skills, right? So our students are able to do that. Yeah. Most of our students did not have the IT background, for example, right? They don't come from Bachelor of IT, Bachelor of mathematics. Of course, we also welcome students who are from these two fields. Yeah. So that's not something that should stop our students from joining. Yeah. So next question. Usually got how many students per intake? We don't limit our number of students, right? So you you don't need to worry about you hit the limit of number of students, and we have around 15 students per intake. We have around 15 students, adult students, master students. So our students are all working adults, not students who are at the teenage. And would it be very challenging if I have zero knowledge in healthcare, as I'm from full-time working in IT domain? So I would say you will be you will feel quite at home. So most of the modules are quite IT intensive, but we have what is it called? IT with healthcare fusion. And then we provide the healthcare context. IMU itself is a healthcare university. So you'll be phased in very easily, and you'll be working around students who are in healthcare domain. So that's not a problem. So you will you will fit in very comfortably. So next question is, how big is a typical cohort in this course by full-time and part-time? So roughly full-time and part-time is half, right? So it's like 15 students per cohort. And of course, we welcome students to join us, and that's not a hard limit. Right. And what is the typical weekly schedule and class timings? So we will have class in most weekends other than holiday, public holiday, or year-end holiday, Hari Raya, Chinese New Year. Those will be exceptions. And then you will have classes in the weekend. Whenever possible, we will schedule it in the morning, but about half the time you should expect until the class lasts from morning until early afternoon, right? In some scheduling difficulty, we might have a 7-hour class day, but that's just occasionally, right? Can you explain about the fee structure? Fee structure, I will leave it to our marketing colleagues to answer. And can you share who this course is not for? Okay, Prof. Saravanan.
Thank you. This course is not for, I guess, those who are not really interesting to upscale with technology. So if you don't like technology, if you are not in tune with understanding the purpose of digital health and wanting to transform yourself as a digital health leader, then this course is not for you. I think essentially you may need to have that liking for working with data, working with technology, understanding how technology can bring purpose to healthcare. If that doesn't excite you, then maybe the course is not for you. Thank you. I hope you have answered your question. Thank you.
Just now there's a question about whether it is influence or whether it is the technical proficiency that our course is focusing on, right?
Mm.
Yeah, analyzing data versus influencing or implementing changes. So the course, this Master in Health Informatics and Analytics, we emphasize on analyzing data, implementing changes, and the technical skills,
I think
slightly
we
more than
answered.
influencing. Yeah.
Yeah, I think that question has been answered also already. Unless we missed it, I think it's answered. Yeah. For someone, I think most of it answered. Um, Usually, how many students done? How intensive done? Fee structure. I think the only one pending is the fee structure. How big is a typical cohort for this class? I think answered already. Class timings also answered already. What kind of support systems are in place for students, especially those from non-technical background? As I mentioned that just now in my kind of introduction. If you do not have a technical background, that's okay, because the instructors are going to help you. I mean, just take Dr. Khairul, for example. He loves technology. Uh, but he's from a medical background. He's a clinician by training, right? So the instructors are there to help and support. So um, not to worry there lah. If the person asking this question is worried that am I going to like feel out of place? No, don't worry. The instructors are there to assist and will take you from zero, but we'll ensure that you'll become a hero lah in the end. That's the goal. What else do we have here? And are there any roles in HIA, okay, that are solely available to clinicians? I think maybe if you can just associate with a lot of the new developments, right? A lot of the people that I work with, they are actually clinicians that I work with. They are actually in awe, and they are using a lot of tech um, for their patient diagnosis, things that data that they look in day out. So yes, there are a number of roles in HIA that are solely available to clinicians. But if you want me to look up for you from a job street or LinkedIn kind of search. I think don't just look for clinician, healthcare, that kind of thing. So try to broaden your keyword search and you will find. And many of these positions are very internal. So they advertise them internally. So if you have any friends within the hospital who are hiring, they'll definitely be able to hook you up with this kind of jobs. So that would be my answer for that question. Do we have any questions unanswered yet? Back to you, Dr. Chua.
Okay, what kind of support systems are in place for students, especially from non-technical backgrounds? Okay, the support system mainly come from the lecturers and your classmates. Our lecturers are very open to helping students with their coursework, right? So if you have any difficulty, challenges, you approach our lecturers. So we will definitely work together with you to overcome your challenges. So all our lecturers, including myself, the program director, and Prof. Saravanan, we are available to help the students in terms of fitting into the academic requirements and for example to achieve what you have to achieve in your project, for example. Yeah, we have experience of guiding students not just with the academic work but in real life, achieving what they have to achieve in study and project, and also in their professional career navigation, right? Getting approval for coming to study and getting approval for uh, getting some project approved at their side as well. So we support our students with all our knowledge lah, right? And then you also have not just the classmates but also your seniors. Our program started in 2021 and you have several batch of seniors, right? All their projects that are in our archives, you are able to look at it, not just look at it, we have the context and we are able to reach them for giving advice, for collaboration. These are very strong support system, not just in the technical field, but in the medical field as well, and in terms of network. So this is actually a very strong support system that we have built over the years, I believe. Right. Then next, please share more about what roles are available for doctors. Would like to understand the level of influence and impact one can make without. Let me understand this question. Are you asking about roles for doctors, or are you asking about roles for non-doctor? So probably if you're asking about roles for doctor, we can ask Khairul to talk about it a little bit. But if you're asking about roles for non-doctors, our students who are coming from uh, non-medical background, they will be able to work in areas such as health analytics, just the analytics part, right? About data, being a data scientist, uh, being an AI scientist, right? There are a lot of jobs there, right? And being a doctor, managing clinics, managing a team of doctor, if you're given the background, the skills and knowledge of health informatics, then you will be able to lead, right? Dr. Kairu, would you like to share a little bit?
I think the question is about what can we contribute in terms of HIA in those for doctors. What can we contribute? And then if there is then if not as a clinical background, that one I'm not so sure. But I think what can we contribute when you are in the position of management lah. Especially when in my position when I'm managing certain parts of data, patients data or our staff data, our staff data in our department. So you need to manage and make this simple. Let's say uh, in this HIE is let's say in my department itself, I have a problem list which is my patient cannot admit to the ward because of communication problem between our department floor and the bed management unit in our hospitals. So I need to communicate this. So the one that communicate this is by to ease the communication process by integrating the HIA, the data itself, how to make it easier and to make the flow of process smooth in terms of patient journey. And this can lead to a lot of problem solving in the department itself, like overcrowding, patient satisfactory, and also us as a clinician become more satisfied in patient management, not just clinical problems alone. So this alone problem is can be tackled by our HIA itself. So I think that is what we can contribute. Apart from that, is data management itself. There's a lot of data in the department is being collected, but it's not being processed into something that is useful for our future improvement. So that's the thing that I think is lacking in our healthcare system. It's that we need to be digitalized with and then data collected to be processed, and we can like create a lot of AI integration to increase our decision making. That's the part that I think we need to be improved lah. But in terms of in the hospital itself or in KKM itself, there's a few openings that is offered for these HIA candidates. My few of my friends, which is the senior batches of this program, already into few spots in KKM. That's they wanted this kind of people who's graduating from this program because it is beneficial in certain units in KKM per se. So that opening is you have to look for. I'm not so familiar with that, but there are spots for that lah. And even in your department itself, they need us for those who can give the data, give the simplified dashboard that can help in decision making from day to day. Even in hospital itself, even pengarah hospital also wanted this data to be simplified because they don't know how to look at this Excels or the sheets. There's a lot of thousands of rows. They want some data is just simplified, and so they can decide making decisions. So we are the one that bridging them between the clinical um, outcome and the informative parts, which is beneficial. Yeah.
Okay, I think we have answered 20 questions, which is impressive, and we have a very participative attendees, audience.
Audience, very good.
Yeah, very, very participative. Thank you for your participation, and I am very delighted to have delivered the talk together with Prof. Saravanan and Dr. Khairul. And I hope we answer most of your questions about this program and also help you to plan your future of upgrading yourself in the health analytics domain. Okay, thank you, and I think we can conclude the session.
Thank you. Good night.
Thank
Okay,
you.
thank you
Good
everyone.
night.
Selamat Hari Raya.
Selamat Raya. Yeah.
Selamat Hari
Yeah.
Raya.